Good afternoon, everyone, and welcome to the Ajax Public Library's Dementia Awareness presentation, presented in partnership with the Alzheimer's Society of Durham Region. We are hosting this presentation today to recognize Alzheimer's Awareness Month, which is in January. My name is Julia Campbell, and I am the Adult Services Librarian at the Ajax Public Library. I wanted to start by quickly covering a couple of things on Zoom, just in case there's anybody who is new to using it. As I mentioned, today's presentation is being recorded, so I would ask that you please keep your webcam and your microphone off so that you are not displayed or heard in our recording. The camera and microphone icons are found at the bottom of your screen. In the top right of your screen, you will choose the view that you prefer. So the speaker view will allow you to see the speaker and presentation, and the gallery view allows you to see all participants in the program. And I will leave it to you to decide which view you would prefer. The chat button is along the bottom, so if you have any questions or comments you would like to share, please use the chat. You have the option of chatting with everyone, or you can send a private message to myself. And please, I would encourage all of you to ask questions throughout the presentation. We will do our best to get to them either during the presentation or at the end. We will also leave time for a Q&A. If you would prefer not to see the chat screen along the side, you can click the chat button again at the bottom and it will disappear. If you experience any technical difficulties this afternoon, I recommend that you exit the program and then re-enter. And if you continue to have difficulties, please place a comment in the chat and I will do my best to assist you. I think that covers the basics for Zoom, but please, if any other questions come up along the way, don't hesitate to use the chat as I will be monitoring it throughout the program. So now I would like to introduce our presenter, Loretta Tanner from the Alzheimer's Society of Durham Region. Loretta has worked in public education for Alzheimer's Society of Durham Region since 2005. She has over 30 years of experience in the field of seniors' mental health and originally trained as an occupational therapist with a certificate in gerontology, later pursuing a master's degree in education. On a personal note, she was part of a family caregiving team for her father, who lived with Alzheimer's disease for 10 years, and her mother, who lived with vascular dementia. And at the other end of the spectrum, she is loving being a grandma. We feel very lucky to have her with us today. So without further ado, I will turn it over to Loretta to start the presentation.
Thank you so much, Julia. Thank you for the invitation. And I'm so pleased to have everybody here and spending an hour with us to focus on dementia awareness. And as Julia said, January is known as Alzheimer Awareness Month. And I mean, it's just a great opportunity to shine a light on dementia and to talk a little bit about it. This is a sort of a new territory, I think, navigating the world of Zoom. I do prefer to see everybody's faces and to have that dialogue as we go on, but we'll do our best. And I think Julia is going to get my attention if there's a question, if something doesn't make sense. But please jot down, make note of any questions or any clarification that you need, and we'll also have time at the end. So without any further ado, I think I'm going to actually start off with a couple of polls before we launch into the slides. So I'm just to get a sense of kind of where people are at. So this is a fairly open question, just trying to appreciate if how many people in our audience have had a personal impact of dementia. So whether it's someone close to you, whether it's yourself that's living with cognitive impairment, just that broad sense. Okay, so I think I'll end the poll there. And not surprising again, but I think that's actually just a really, I think sort of a very typical breakdown when we do speak to groups, and kind of touching on the amount of people that are personally touched by dementia in many different ways, and why it is so important for us to talk about it and raise that awareness. So I'm happy that you're all here, and look forward to more conversations. All right, hopefully everybody saw that all right. I'm going to got a couple of other questions. Okay, this is getting a little bit at some of the myths of dementia. So you can choose multiple answers here. Okay, let me end the polling and share the results. So again, thank you for taking part. And yeah, so each of those statements really represents a myth. And so, you know, but it shows that there's a lot of uncertainty out there. And I know we do get a lot of questions pertaining to that first point about genetics. It's a complicated area, so we're going to touch on all of those areas. But in a nutshell, typically, that in terms of and this in this question, it's focusing on Alzheimer's disease, and in most cases of Alzheimer's disease, family history is a risk factor. So we're going to look a little bit more at the risk factors. So the most common form of Alzheimer's disease is known as sporadic Alzheimer's disease, and again, people may or may not have a family history, and the genes that have been identified associated with sporadic Alzheimer's disease are more likely to be predisposition genes that are normal genes that just sort of might increase your risk slightly. So it's not necessarily a certainty that a person with that family history will develop the disease. There are rare forms of Alzheimer's disease that are stronger, have a more significant familial impact. That represents less than 5% of all the cases. So it's more of the rare situation. And we will touch on the fact that certainly aging is a risk factor, but people that are under age 65 can develop dementia as well. Not as common and not as prevalent, but certainly doesn't only affect older people. And I hope that we have a chance to hear from a gentleman. I've got a video, and just that we can speak to that idea that people can live well with dementia. And that's a really important message. And certainly it's a challenging diagnosis to be given, but it is really important to be able to understand that we even there are supports, there are treatments and strategies that can help people live well for as long as possible. So that's just a quick nutshell. Thank you for participating in that poll. And let me just try one more. A little bit of what kinds of things you do to support your brain health. Oh, I don't think I launched the poll. Sorry about that. All right, I'm going to end the polling just so we can get a bit of a kind of a visual there. Wonderful, wonderful. So I'm really happy to see that broad array of practices that people are having. And I know under our restrictions, there's more challenges than ever in pursuing many aspects of our healthy lifestyle. But so I'm really happy to see that certainly that staying connected is right up there. And as well, along with regular exercise, which is probably one of the number one things to do. And we'll come back to that list in a little later because there's some less popular things that you may not have been aware of that are supporting brain health. All right. Okay, let's move along. Thank you for that. So this is what we're going to cover. We're going to really accomplish a bit of an overview of dementia today. I mentioned already that we're going to be talking about the idea of risk, and I'd like to share with you a little bit about how the Alzheimer's Society of Durham Region can help. And what you should be seeing now are 4 possibly familiar faces. And I don't know if anybody wants to type into the chat what you think they might have in common. And Julie, are you able to keep tabs on that?
So somebody has typed that they were all leaders and all possibly suffering from dementia.
Yeah.
All had ALH, high profile people, dementia, all suffered from dementia.
Yes, that's a yes. So exactly, and but I like the fact that we kind of got a full picture there, and that's an important message. So yes, all of those people experience a diagnosis of some form of dementia. We may or may not sort of, when we think about them, we're perhaps thinking about their leadership or other aspects of who they are as a person. And one of the reasons that we like to kind of bring some public figures to the table is that idea that certainly the experience of dementia can happen to anyone. And one of the reasons that we have an awareness month is because quite often there's still a sense of stigma associated with dementia, Alzheimer's disease, that those terms, we perhaps carry ideas and misconceptions that may even interfere with people talking to their doctor about memory problems, or certainly people's lived experiences that they feel that they're being perhaps treated differently after they share that they have a diagnosis of dementia. So again, that's why it is so important to talk about it, to think about it, and realize that this is something that can literally happen to anyone. That there's certainly, you know, geographical and boundaries in terms of people's background and work, their status. So it crosses all of those backgrounds, and it puts us all on the same playing field, I think. And just a little bit of kind of some of the numbers. We've got a little bit of a graphic there that's kind of speaking about the impact. Whoops, sorry about that. And what you're seeing is the kind of the approximate growth that these numbers that we're looking at, possibly up to as many as 1 million Canadians estimated to be living with a form of dementia in 2031, or by 2031, that there's women seem to be disproportionately affected, as we've got to sort of the especially with respect to Alzheimer's disease. 66% of those affected are women. You see the association with age, and one of the stats that we talk about is after we reach age 65, the risk starts doubling every 5 years. So those are just some of the aspects of dementia that's important to recognize. Certainly there's a cost in terms of personal impact on individuals, but also on care partners, and we want to be able to recognize that people that support an individual that's living with dementia, we use the term care partner. Care partner distress is 5 times greater compared to caring for individuals that aren't living with cognitive impairment. So certainly that places additional challenges on the caregiver. Many caregivers report declines in their general health, certainly disruptions in employment, and there's a high association with psychological distress. So care partners are at risk for depression and anxiety. So it's very important that we not only support our friends and family, neighbors that are living with dementia, but also their family as well. And just to touch on, what are we talking about when we use the term dementia? What is dementia? And that unfortunately might be getting blocked by the bar. But so dementia itself isn't a specific diagnosis. We think of it as an umbrella term, and it represents not only a set of symptoms, so it represents a clinical syndrome, but it also represents a category or a group of brain disorders. So we're thinking within that umbrella of dementia, we are talking about disorders that include symptoms of memory loss, changes in thinking, problem-solving language changes. So there's cognitive impairment as part of that syndrome. That the cognitive impairment is significant enough that it's affecting daily activities or function, that there's a strong association also with mood and behavior changes, and putting all of those elements together, certainly dementia has a significant impact on the ability of an individual to manage their life. And so that's kind of what sets it apart from what we might term mild cognitive impairment. And so we are recognizing that it's caused by disorders that affect the brain, or a significant degree of damage to the brain, which of course is our most vital organ. And it's important to also emphasize that dementia is not normal aging. So many of us can complain about memory changes that we might be noticing as we're aging. But there is a difference between the kind of symptoms that perhaps we might term age-related changes and that represent symptoms of dementia. So that there's a kind of a difference in the nature and the severity, and even the frequency with which the cognitive changes are occurring. And I hope if you have further questions, some of them will be answered as we go along, but we'll certainly have time to address questions. Now, one of the big things that we get asked a lot is, kind of, what's the difference between Alzheimer's and dementia? Are they the same? And you already heard that definition for dementia, and we talked about that term as not a specific diagnosis, and it represents a group of disorders. And so under that umbrella of dementia, what we are seeing right now are a number of specific disease processes. So these represent some of the most common forms of dementia or types of dementia, and these are considered disease processes that ultimately cause damage within the brain and result in the syndrome that we call dementia. So you're seeing perhaps Alzheimer's is the most common cause. We probably know the most about it, but certainly not the only form of dementia. You may have also heard about vascular dementia, which is related to changes in the blood supply of the brain. And that can be connected to stroke activity. It could be related to changes in large blood vessels, small blood vessels, but ultimately the vascular damage that's occurring is generally accumulating over time and causing that added impact on brain function. So that change when there's significant enough symptoms would be known as vascular dementia. Lewy body dementia is a form of dementia that's in the family of Parkinson's disease. So that people can experience similar symptoms to Alzheimer's disease, so cognitive change, but also motor symptoms that we might think of as common to Parkinson's disease. So what you see perhaps is an umbrella, and under that umbrella are other smaller umbrellas perhaps. So the picture does start to get more complicated. You'll also see another term, frontal temporal dementia. There's another group of syndromes that represent frontal temporal disorders, and each time that we're talking about these different conditions, they represent different pathologies, perhaps various different parts of the brain are affected. Frontal temporal dementia affects primarily the frontal and temporal lobes of the brain. So again, may look a little different than perhaps what we think of when we are familiar with Alzheimer's disease. And just the final category is mixed dementia, and that's really representing that a person could have more than one disease process affecting their brain. Generally speaking, it's not uncommon to see Alzheimer's disease perhaps and vascular changes. So it really shows that the brain can be impacted by many different things, and ultimately that that overall damage and how that person is experiencing it and functioning, that's really what we identify as dementia. It really is representing those symptoms. Those are the most common. Certainly there's other conditions out there, but those are perhaps the most common that we see, and particularly associated with aging. So I'm hope all of this is coming across loud and clear. It's important when we're thinking about dementia that we also recognize that there's perhaps other kinds of concerns that could be causing cognitive impairment, that it would be treatable and reversible. So that's what you're seeing here is a bit of a graphic, and that's reminding us that not all memory problems, for example, or not all cognitive impairment mean that a person has dementia, and that it's possible to have changes and disruptions in other parts of the body that can cause changes in brain function. But perhaps once the problem has been identified and treated, the cognitive change will improve. So it's what you're seeing is kind of some of the different organs, but certainly even if we are thinking about the brain, it's possible for somebody to experience a severe depression, for example, and that can look very similar to dementia. And so you can see why just having memory problems or some of the warning signs doesn't mean that diagnosis. And it's really important for people to have an evaluation, to have a workup when there's any changes, either in cognitive abilities, in behavior, or in mood, particularly in an older person. So you could also, some of the other things that we think of that could be treatable causes of memory and cognitive problems might be related to medications, perhaps side effects of medication or drug interactions. It's possible also for a person to experience nutritional deficiencies, and the result could look very similar to what we think of as dementia. Metabolic problems such as thyroid disease could also potentially cause disruptions and changes in cognitive ability, as can heart and lung problems, and even infection. And particularly, this is where aging comes in. Because of our changing physiology with aging, we might be more prone perhaps to the impact on our cognition if we have an infection when we're in our 80s versus experiencing an infection when we're in our 40s. So it's always important when there's concerns about memory and other changes that our first stop is to talk to our doctor and get that looked into. And that's what we're looking at right now, is the idea of dementia risk factors. So what you're seeing is kind of a two-sided diagram. And earlier on, I touched on the idea of risk factors and spoke a little bit about Alzheimer's disease, and we touched on genetics. And I always like to define what risk factors are, just so we understand, because we talk about that a lot. So risk factors are aspects of lifestyle, environment, and genetic background that contribute to the likelihood of getting a disease. Risk factors on their own are not causes of a disease, but they represent an increased chance, not a certainty. And on the other side of that coin, having little or no exposure to known risk factors does not necessarily protect us from developing the disease. But we talk a lot about risk factors associated with dementia, because it's known that there's generally speaking not a single cause. And our understanding about why the various forms of dementia happen generally refers to the fact that risk factors in individuals accumulate and potentially can overwhelm the sort of natural healing resources of the brain. So there is that interaction between those risk factors and our overall health. And back to those two columns, some of these risk factors we can't do a lot about. And we've touched a little bit on our genetics and perhaps those predisposition genes, or even possibly, you know, if we're in a family where there's more significant genetic involvement. There's our gender. There's other health conditions. Sometimes that can increase our risk. So having a diagnosis of Parkinson's disease, that can be an added risk factor for dementia. Doesn't mean dementia will develop, but it just adds another risk factor. So the non-modifiable factors, we can't do a lot to change. But what's really, really important is the left side of the diagram, and that's the modifiable risk factors. And that's really what we want to focus on, because anything that potentially we can avoid, we can reduce, we can treat, any of these things can change to something then that protects us. So what you're seeing on the diagram, hopefully, are and making sense of are, you see the heart, and there's many cardiovascular risk factors that also increase our risk for not only for heart disease and stroke, but also dementia. So also increase our risk for Alzheimer's disease and vascular dementia. So anything that we can do to reduce blood pressure, high cholesterol, manage diabetes, maintain sort of good levels in our blood sugar, reduce or discontinue smoking, address obesity, all of those things, we can go a long way to protecting our heart and also our brain. There's also other factors such as activity level, and you'll notice that the ear is there, and that's hearing loss has recently been added to the list of risk factors, so that there's still not a clear idea of what the relationship is, but there does seem to be a relationship between hearing loss and risk for dementia, and therefore, again, treating hearing loss and getting that seen to, perhaps using a hearing aid, may go a long way towards reducing that risk. So I think, again, the message is that anything that we can do to address the risk factors, and it's known that that can give us as much as 30 to 40% reduction in risk. And sometimes the more risk factors that we can tackle, there's new studies all of the time that are showing the potential beneficial impact on that risk reduction. So it's not insignificant. So through the rest of the presentation, we're going to be walking our way through these kind of 5 steps that are pertaining to dementia awareness. We've already talked a fair bit about risk factors. I'm going to just touch briefly on some brain health strategies. We'll come back a little bit to the early warning signs, talk a little bit about diagnosis and treatment, education and how important that is, as well as positive approaches to living well. All right, and I just really wanted to highlight brain health strategies, and that goes back to the poll we did earlier, and this is just kind of some key pillars of brain health, and just reminding us that many components of healthy lifestyle, which help us in so many other areas of our life to stay well, can also be very significant for our brain health. So certainly our healthy food choices, a nice balanced diet. It's been said that a Mediterranean style diet is particularly healthful for the brain, but certainly that's right up there. Activity level, there's really no kind of getting away from the benefits of physical activity and doing whatever we can. Again, perhaps checking with our doctor first, but doing whatever we can to keep moving in a way that's reasonable for us. Stress management continues to be important because, unfortunately, chronic stress in particular can have kind of a counterproductive impact on the brain and the body. So anything that we can do to promote relaxation is going to be beneficial for our cognition and for our overall brain health. And the health management is referring to things that we touched on earlier, such as our blood pressure, blood sugar, our cardiovascular risk factors, our weight, just thinking about alcohol and smoking. So all of those things that can promote health and wellness. We already saw good input in terms of how important staying connected is for cognitive, physical, and mental health. Protecting the head is obviously a good idea, and we don't always think about it perhaps, but when we put on our seatbelt and we use our helmet when we ride our bike, and anything that we do to make ourselves more stable and avoid falls, that's also protecting our brain, and it's not great for our brain to sustain a head injury. So whatever we can do to avoid that. And regular intellectual stimulation, of course, and staying engaged. There's no one activity that is the best. Whatever we can do to stay interested and engaged in life, and pursue something every day if we can. What you're going to see now are what we call the 10 warning signs. And that's just a little bit of a list. We use that in public awareness, just to raise awareness of the common symptoms that are often seen with respect to dementia. Now, these are not the only symptoms. And the importance of this list is also just to flag that perhaps there might be changes that we might not necessarily think about. So we're often very familiar with memory loss. And it's also important to recognize that it's certainly not just memory problems. All sorts of memory problems that are a concern, but particularly when memory problems are affecting day-to-day abilities. So that disabling or serious impact of the memory changes. Just to flag a few of these areas, changes in orientation in time and space can be a red flag. So if somebody's getting confused and getting lost coming home, or a little bit unsure of what year it is, or the date, and that's a little different than when we go on vacation and we kind of lose track of time. So each one of these areas, it's there's probably a certain amount of normal changes, but we're looking for more significant red flags. Impaired judgment, and that would be something that's distinguished perhaps from a person's usual functioning. Something that's perhaps that stands out, and maybe not recognizing a medical problem that needs attention, or perhaps not choosing appropriate clothing for the weather. So all of these things can potentially be red flags. Could a change in disposition or personality that seems to be more sustained, even that loss of interest in usual activities, all of those things could potentially be red flags. And the importance of this list is not a checklist for us to say, uh-oh, I have Alzheimer's disease, but more for us to notice things that perhaps we should be sharing with our family doctor or our healthcare provider, and get it looked into. That's really what this is all about, is noticing change and realizing it is important to maintain the health of our brain. And this is something that perhaps should be investigated. So that takes us to the area of diagnosis. And this can be a challenging area because it's not necessarily easy for to obtain a diagnosis of dementia. But the first step is to talk to our healthcare provider. And as was mentioned, that there can be other underlying conditions that can look very similar. So when we talk to the doctor about changes in our memory or about our concerns, it really just starts that process of perhaps the doctor doing a good medical workup, running some blood work. They may or may not do some neuroimaging. It depends on our presentation, our medical history. They may send us to a specialist, to a memory clinic. So it can be very individual, but ultimately being able to have a good, thorough workup is very important. And I know, again, more challenging under our current conditions of COVID restrictions, but certainly our brain health is worth it. So that early diagnosis potentially can be beneficial in that it perhaps maybe helping people to make sense of symptoms that they're experiencing, can help them think about how do they optimize safety, think about future planning, think about what treatments are available, because there certainly are some treatments for symptoms of dementia. There are some medications that have been approved for Alzheimer's disease and used in vascular dementia, Lewy body dementia, and there are a range of symptoms that have potential treatments, as well as important to know about the support and the strategies for coping with symptoms, and reaching out within the family and within the community for support. Okay, what you're seeing now is a little bit of kind of talking about the progression and what we expect when a person has been diagnosed with dementia. Most of the conditions that cause dementia, so Alzheimer's, Lewy body dementia, frontotemporal dementia, by their very nature, those conditions are progressive degenerative conditions that spread through different areas of the brain and cause damage over time. So we often refer to stages. And people can, can vary in terms of how fast moving the changes are. But in general, would say with respect to Alzheimer's, we think about the course to be sometimes as short as 3 years, but as long as 20 plus years, and on average 8 to 10 years. So certainly there's a range of progression, but people can live well for many years and with appropriate support. And you're kind of seeing sort of some overall changes that people may experience over time. And that's one of the roles of the Alzheimer's Society. And certainly there's a lot of information and resources out there, but it's helping with a diagnosis to introduce people to these resources so that they can start to learn a little bit more about what to expect and how to make adjustments in life. So that's what this slide is touching on, how important it is to be educated. And the Alzheimer's Society certainly can play a big role in education, and it can be very important for people to start to connect with others that are experiencing the same challenges and share their stories and feel that they're not alone. So that's another good reason to connect with the Alzheimer's Society. And this is just actually a link to our website. And we're coming to the end of Alzheimer Awareness Month, but we certainly have a lot to offer, and I will show you a slide a little later on that shows the scope of our programs, but certainly support, education, and information, kind of our core programs, but we also offer social recreational programs, adult day program for people with young onset dementia, as well as enhanced skill training and support for care partners. So that's just in a nutshell some of the things, but we really encourage people to connect with us, and we can walk you through what we have to offer. And as you can see, actually, I didn't mention it, but we do also offer services in French. I would like to mention that safety is a significant concern. It was mentioned earlier, and just a few stats, because that experience of disorientation that I mentioned earlier is it's a common experience, and so there is that risk that people have of getting lost. So whether it's related to changes in just memory function, but also the parts of the brain involved with navigating, kind of helping us with the kind of topographical navigation. So it's good to think ahead about what are some safety things that we can do to support individuals. So I have a bit of a question there about how common it is for people living with dementia to go missing. So I don't know if anybody would like to put an answer into the chat, what you think, how many out of 5 people living with dementia go missing. And time is of the essence, because if people aren't found within 24 hours, that certainly increases their risk. So this is a vulnerable population, and people are often within their own communities. So it's something that there's a big opportunity for us to help each other. If we do come upon somebody that looks like perhaps they're confused and not sure where they are, to reach out and to ask if we can help. Did anybody put anything into the chat?
Yes, we have a few guesses. One person said 2, and then 3 people have guessed 3 out of 5.
It's 3 out of 5, so
Oh, great.
60%. So it shows you it's fairly common. It's certainly not something that everybody experiences, but that risk is there. And so that's one of the things we advise people to think a little bit about some precautions to take. And it doesn't mean that people shouldn't continue to, if they enjoy going out and being as independent as possible, but to take some precautions. And certainly that's something that always needs to be reassessed over time. And that website, findingyourwayontario.ca, is a huge source of all sorts of information of many things that people can put into place, and including, as part of their safety plan, a medic alert bracelet, which is sort of a visible kind of a visible cue that a person may need support, and there's a 1-800 number on the back of that bracelet. It advises, perhaps if a Good Samaritan comes upon somebody wearing that bracelet, to call the police, and the police also have training on how they can help. And it was because we don't want to leave the person alone if they seem to be lost or confused. The Durham Regional Police Service has a voluntary vulnerable person registry that is also a step that individuals or families can take, so that if somebody does go missing, that we can call the police and they can pull up that file and they can share that amongst the officers, and they can start their search immediately, so it saves time. And it's also important just to notice here, if we are perhaps supporting someone, if we come upon somebody in the community, or if we have a friend or family member, that we may need to adjust our communication. Somebody that's experiencing memory problems, perhaps, or language difficulties, they may need a little longer to process what we're saying. So just being aware that somebody might need more time, being aware of the words that we use, perhaps gestures, that can kind of support what we're saying. Perhaps avoiding big questions such as, how can I help? Maybe just asking a question that the person can answer with a yes or a no. Those are all sort of good, sensible communication strategies to use. And in general, when we're supporting our friends that live with dementia, we avoid confronting or correcting them, really we're trying not to make them feel embarrassed or ashamed. And certainly when people experience memory problems, the wrong word might come out, and they need to feel supported and not that they've made a mistake. Alzheimer's Society, an important function that we do have is supporting the care partner. I mentioned that there certainly care partners are at risk for distress themselves and need as much support as they can get. So we do hope people that connect with us and learn how we can help. I was talking earlier in the day with some families, and we were just talking about the idea that it's so important, that idea that it takes a village. And this is very much the case when we're supporting our friends that are living with dementia, that we need as much support as possible, because sadly, sometimes friends drop away after a diagnosis of dementia. Touching on some of the Alzheimer's Society programs, this is a newer program the last couple of years, and I should add that most of our programs are being offered primarily online right now, but we are still delivering kind of our same array of supports. And this is enhancing care for our family care partners, which is sort of additional skill building and therapy for care partners. And so lots that can be offered, including mindfulness support. One of the things that the Alzheimer's Society staff also does is help navigate people through the specialized services that are available. And within our health system, we have a number of what we think of as sort of specialized geriatric services. And it's that background in geriatric medicine or geriatric psychiatry, gerontology is so important, because as we get older, sometimes we can experience health changes, but perhaps the symptoms don't look exactly the same as they do when we're younger. So that geriatric influence and expertise is so important, and that also comes to looking at treatment. So our emergency department has some geriatric specialists. We have a great team within the community and the hospitals called the GAIN, Geriatric Assessment Intervention Network. The MINT memory clinics, they are run out of the Alzheimer's Society. So these are teams of health professionals that work with family doctors to assess memory. Ontario Shores has some geriatric services, and a lot of our funded community supports also have people that have special expertise in understanding behavior change. It's very important for people that live with dementia to stay active. And we do have social recreation programs. We do actually, since the COVID restrictions, we have been creating activity boxes and doing contactless delivery for individual with some activities and supplies just to help people keep active. And we're doing some visiting kits as well. And we also have fundraising events that support us in the activities that we provide. I'm not going to get a lot of time to talk about the Dementia Friendly Communities to show you the video, but perhaps I can share that. through Julia. But this is a kind of a very similar movement to age-related communities. It's thinking about what can we do within our municipalities, within our cities, within our towns to support our friends and neighbors that are living with dementia. How can we help them to feel welcome at the grocery store or at the bank, so that they're not feeling ashamed if they need a little bit more time or patience. And just some of the phone numbers for the Alzheimer's Society, and just a note that we benefit from donations. We are very accepting of donations. We do receive funding for our programs, but that doesn't cover everything that we do. So we're certainly always appreciative of donations and people that participate in our events. And so just to kind of give you the final slide, dementia is a life-changing condition, certainly has a widespread effect on families and communities. We never want to lose sight of the individual. Think about, certainly despite the symptoms of dementia, their history, their life experience, and their dignity is still important and needs to come to the forefront. A person living with dementia might respond differently to certain situations, might be perceiving their environment differently. So we need to adjust how we communicate. So the change has to be on the part of the supporters. We all want to be able to think about protecting our brain, think about reducing our risk, and also the importance of early diagnosis. So if you or someone you know is diagnosed with dementia, please do reach out to the Alzheimer's Society and help us to support you in getting the care that you need. And I'm going to stop the share right now so that we can get to some questions.
Great, thank you so much, Loretta. So as I mentioned, I have a couple of questions now, and then after we finish those, I'll turn off the recording so that if anyone wants to unmute or put their camera back on, they are welcome to do so at that point. So the first question was, back when you were discussing the warning signs, someone just was hoping you could expand on the memory loss, which was the first point.
Yes, yes. Well, and yes. So the memory loss was trying to distinguish a little bit between perhaps the kind of memory loss that we experience. So if I was to ask everybody here today, how many people complain or have concerns about memory changes? Probably many of us would put up our hands. Sometimes when I'm in groups, I ask, is anybody in the audience not complaining about memory problems? That might be a better way, and perhaps kind of put your hand up. So certainly our brain changes with aging. There are normal age-related changes as there are normal age-related changes to other organs within our body, and there's a wide variation in how we experience and the impact of those changes. And sometimes that can be aggravated even by some of our other health problems. So we recognize that there's a continuum to cognitive change. And even so we're starting to understand that normal age-related changes kind of can be representative of certain memory problems that can be annoying but perhaps not disabling. There can be more substantial memory problems that might be identified as mild cognitive impairment, and that can be noticed on testing. But typically what differentiates something as perhaps more of a concern is where the impact is on daily life. So it's the severity, again, and the frequency of the memory problem. So that's why you're seeing the first point, which was affecting day-to-day function. So it might be pertaining to having problems doing a recipe that I've been doing all my life, and it doesn't mean I forget one thing and it's isolated, but it might be something to be more concerned about if there's other examples, if there seems to be an increase in problems over time. And we sometimes use an example of I forgetting where I parked my car might not be a cause of concern, but forgetting that I brought my car might be more indicative of a significant concern. So it is challenging because you know, I think it's to there's lots of grayness in that whole memory problems, but it's trying to distinguish it from the kinds of things that we all experience. Yeah.
Great. Thank you, Loretta.
Yeah. Thank you. And you maybe come back. I think we're talking about brain health in February, but you know, there's even strategies that we can think of that can kind of enhance our attention often, that helps us with some of those sort of troublesome aspects of memory.
Great. So thank you, Loretta, for your presentation. I'm going to stop the recording now. So if
Okay.
anybody would like to ask a question, you can feel free to turn off your mute and turn on your camera.